About 1 minute. Oh, I'll say that again. Good morning, everyone. We'll begin in 1 minute. Thank you. Watching all of these participants roll in. I'm going to get us started. Good morning, everyone. My name is Pamela Robinson. I'm the director of the School of Urban and Regional Planning at Ryerson University, and I'm also the interim academic lead for City Building Ryerson, our newest initiative to gather the impactful city building work that our faculty members and students are doing at Ryerson. Welcome to our very first COVID in Focus webinar, and it's presented by City Building Ryerson. This is the first of a four-part series in which we're going to highlight Ryerson research at the intersection of city building and COVID-19. Joining me today is my co-host, I'm really excited, Nico Kasakad. Nico is a recent graduate of the Urban Planning Program at Ryerson, and he's the Metcalf Foundation's program intern. His work focuses on how can we collaboratively plan and develop our cities through a social justice and equity lens. So I'm delighted to have him as part of our session. And together we're going to listen to more work about Terri Peters' work. Over to you, Nico.
Thank you, Pamela. While we are meeting virtually today, I want to begin by acknowledging the space in which the Ryerson campus and community is situated. Toronto is in the Dish with One Spoon territory. The Dish with One Spoon is a treaty between the Anishinaabe, Mississaugas, and Haudenosaunee that bound them to share their territory and protect the land. Subsequent Indigenous nations and peoples, Europeans, and all newcomers have been invited into this treaty in the spirit of peace, friendship, and respect. As city builders, we need to continue to reflect on how our profession and practice upholds, or not, the rights of this treaty. We are all treaty people, and we have a large role to play in taking care of the land and ensuring that Indigenous communities can and continue to lead that work. I'd like to invite you all to reflect on your personal and professional role in advancing reconciliation.
Thank you, Nico. I'd also like to note that today is Orange Shirt Day, a day in which Canadians remember the traumatic impact of the residential school system on Indigenous communities of people. Now for a few housekeeping notes. Before we get started, this panel will start with a 15-minute presentation followed by a moderated question and answer period by myself and Nico. Your cameras and microphones should be turned off, but we welcome you to submit your questions to the speaker, to Terri, through the question and answer function at the bottom of your Zoom page. You're also welcome to upvote or support questions that you particularly like to see answered. This webinar, along with the other ones in the series, will be recorded and shared on the City Building Ryerson website. We hope that you'll have a chance to watch it again, but also after you're interested and want to learn more about the work, able to share it with your network and colleagues of people. Now, without further ado, it's with huge, huge affection and excitement that I'm going to present Dr. Terri Peters. Dr. Peters is an assistant professor at Ryerson University's Department of Architectural Science. Terri is a registered architect in the United Kingdom and holds a PhD from Aarhus Architecture School in Denmark, where her research focused on sustainable renovation of modern housing. Terri is going to share her research about quality of life in urban mid and high-rise apartment housing in Toronto and other communities in the context of COVID-19. And she's going to, through her presentation or Q&A today, offer some recommendations for health-promoting apartment housing design post-pandemic. So without any further interruption, Terri, over to you to share your good work. Thank you.
Okay, can everyone see my screen okay there? I hope so. Okay, so thank you very much for the introduction. As Dr. Robinson explained, I'm an architecture professor in the Department of Architectural Science at Ryerson, and I'm going to present some work today that focuses on the impact of COVID-19 on quality of life in apartment housing. And this work was done in collaboration with Anna Holleran, a student that I worked with over the last 4 months. And we the results of the study that we did together are going to be published in an upcoming issue of International Journal for Architectural Research. They have a special issue on the city after the pandemic. We're grateful for the Dean's Undergraduate Research Fund, which helps support Anna's work with me over the summer. So the focus on quality of life in apartment housing, I have some recent work that I've been developing over the past few years with Dr. Ted Kessick at University of Toronto and Dr. Liam O'Brien at Carleton University. So we put together this Merb design guide, Merb being multi-unit residential buildings. And we really focused on the evidence and science behind livability and resilience in this housing type. So this is a publicly accessible document that we put together, and we're working on a new version of it, which will include guidelines for balconies. So the starting point for the research I'm presenting today is that the COVID-19 pandemic is a public health crisis, but it's also a global housing crisis. The role of urban housing has changed in the pandemic, and this presentation summarizes the results of our multidisciplinary study, which examined more than 100 peer-reviewed papers from environmental psychology, building science, and architecture. And we analyzed the most the most relevant findings for their restorative qualities. And I'll explain that in a moment. So we looked at the evidence-based design qualities for livable housing and then combined that with restorative environmental design research. So the area of analysis is really this overlap between housing and restorative design. So restorative environmental design is a theory from environmental psychology that the built environment around us can help us recover from stressors and replenish our resources that are depleted by concentration and distractions using nature. So we identified 7 restorative environmental design principles based on this intersection between state-of-the-art housing research and restorative environmental design and studies relevant to COVID-19 and apartment housing. So we came up with these 7 principles. And I'll just take you briefly through our findings and our summary of what we found in relation to these restorative environmental design guidelines. So windows. Windows are paramount in supporting human comfort, wellness, and health at home. For example, a study exploring people's perceptions of the psychologically restorative effects of apartment housing windows found that the most sky, like views with the most sky in them, are the most restorative for people. This image here, the Picasso on Richmond project, utilizes horizontally staggered floor plates to increase the amount of corner units, thereby creating a variety of light conditions. So the placement of windows and window design is really critical in understanding quality of life and housing design and restorative environmental design. So I have a few examples here. This other project, Aperture, is shown here, is in Vancouver, Canada, and it utilizes exaggerated angular window frames, providing passive shading, framing views of communal green spaces and natural landscape, while simultaneously creating dynamic lighting conditions in the units. So the openings are deeper on the south facade, providing an increase in solar shading, and then more shallow on the north elevation, creating a greater amount of lighting in the interior. And these sort of orientation-specific findings are something that we have seen again and again in our work on livability and quality of life. Like, situations that occur on the north side of the building are very different than on the south side of the building. So we really need to design understanding the orientation of our buildings. Another example of window design and window views. In a study on the effects of nature window views, results showed that even brief exposure to window views throughout the day, it creates these sort of micro restorative experiences. And these can provide the restorative experiences of nature that we need as residents and inhabitants spending a lot of time in our homes. So in our paper and in our work in the last summer, we came up with evidence-based design recommendations. And the first one is based on window views, about views of sky and nature and window placement. The second element is adaptable light levels based on function. So this is a big one, and it's formed the basis of my research over the next year as well, is looking at what is the right light at home. What light levels do we want based on what we're doing in our apartments? So as homes become multifunctional spaces due to COVID, a lot of us are working and living and looking after our children and exercising and doing all of these things in our home. So we need a variety of lighting levels, obviously, to support us in these activities. There's some research on kitchen lighting. So while residents may have spent a little amount of their time in kitchens pre-COVID, studies of daylight satisfaction normally show that kitchen lighting is not a main concern for quality of life. But we suspect this might change as people spend more and more times replacing previous outings to restaurants and bars. Now this is taking place at home. So this is one of the things that might change is our desire for different lighting levels in kitchens. So people will desire optimal lighting levels, not just in their living rooms, but also in spaces that previously weren't such a concern, such as kitchens. And flexible design, as we're all thinking about the different ways we use our home, flexible design will become more important to the perceived livability of apartment housing. For example, architects Woods Bagot have developed a system that utilizes these modular adjustable walls and screens to allow spaces to have different lives as we need them throughout the day. So our evidence-based design recommendation based on adaptable lighting levels, one of our main findings is that daylighting, indoor air quality, and thermal comfort recommendations that we would normally assign for learning and office environments to support productivity, these are starting to become more relevant at home as we start to make the home a place for productivity at times, for learning, for studying. So that's going to affect apartment layouts as these need to be better considered to support the changing role of the home. A major issue that people are having with COVID-19 is difficulty sleeping and impacts on mental health and well-being. Our third parameter that we looked at is circadian regulation, and are bedrooms designed for sleep? So as small apartment units do not offer the kind of space required to create a variety of conditions, people are reporting spending more time in their bedrooms for leisure. They watch movies in bed, scroll through social media on cell phones, and this is problematic as residential sleep studies show that disruptive exposure to pre-bedtime light within the bedroom can disrupt sleep, increase nighttime alertness, decrease melatonin production, and shift circadian rhythms. So how do we design bedrooms for sleep? Huge challenge. We don't want to make worse the ongoing stresses and anxieties of COVID-19, and people's ability to sleep well at night has certainly been affected. So this example here, District Lofts, uses a central light well to allow units to have greater air circulation while providing units with light from at least 2 building facades. So creating a variety in lighting conditions can lead to bedrooms designed for sleep, because in parallel with designing bedrooms for sleep, we need to design other spaces for alertness. So actually we're trying to design a variety of light exposures within the home so that we can have, so that our circadian rhythm can adjust to this new normal of spending so much time in one space. So our design recommendations are: spaces with no windows should not be used as dwelling spaces. No more borrowed light in bedrooms. That is not the way forward. Bedrooms do not benefit from floor to ceiling glazing. We don't need that in our bedroom. And non-bedroom spaces should promote alertness. So in terms of spaces to support well-being, moods, and social interactions, one thing that we found was really relevant is prospect refuge theory, a theory from environmental psychology that argues that psychologically preferred environments are ones where people can see others, but cannot be overlooked or seen themselves. So spaces that provide prospect, a sort of lookout, and refuge is a place to sort of stay back and observe the world. So creating this spatial variety is really important. And our design recommendation for spaces to support well-being relates to creating that variety of spaces, spatial variety, but also creating common spaces within the building that promote social distancing and enhance social interactions. We go into that quite a bit in our paper. There isn't much time to go through all of the nuances of that in this presentation. Thermal comfort and indoor air quality, huge consideration. Often high-rise housing has unacceptably high window to wall ratio. So numerous daylight studies have shown that excess glazing and window to wall ratios above 60%, there isn't actually a benefit to the daylight in the units. So we don't really benefit from the glazing that happens around our feet. Anything below our knee, we're not really benefiting from that in a daylight perspective. So to ensure year-round thermal comfort, this project shown here has punched window openings rather than the full floor-to-ceiling glazing that we're often seeing in new apartment buildings. Ventilation is a serious concern, and the spread of disease is increased in poorly ventilated areas. We see news articles like this about high-rise housing where people are having a sense of mistrust in building ventilation systems. We're relying a lot on active systems, and we've perhaps this pandemic will show that relying on passive systems like operable windows, daylight will be more of a focus moving forward in housing. So our design recommendations are passive strategies for ventilation, operable windows, and thinking of other ways of facade design without floor-to-ceiling glazing, because it's not necessary for optimal daylight, and it causes issues with thermal comfort, privacy, and practicality. Balconies that offer connection to nature. That's a current research area of mine, looking at how to design balconies that don't really negatively impact the daylight in units. As residents spend more time in their homes, balconies have become this new venue for socialization and protest and celebration and daily access to nature. There are numerous studies looking at the fact that people prefer apartment units with balconies. It's seen as a major selling point. Having access to nature is highly desirable. There aren't as many studies showing how people actually use balconies in the different seasons, but I think more research is going to be happening in this area. Our recommendation is that balconies be designed to support daylighting within the home and also enable outdoor space for residents. So in my in-progress work, I'm seeing real trade-offs happening there between balconies and daylighting. And the application of biophilic design should increase, including natural materials, spatial variety, and improved daylighting. So the last parameter that I wanted to share is unit sizes and layouts that support physical distancing. We know that this is an issue with apartment housing. Often the units are too small to allow effective social distancing. And we found that by providing units with 2 bathrooms and having more spacious communal living spaces, projects like this is a good example. You're actually able to create spaces that could potentially be working with social distancing. It's clear that there are economic and political issues at play in the design of health promoting and restorative housing, for sure. We can't solve all of that in our research, but we can certainly identify which areas seem more important than others. So our design recommendations are providing spaces that can support physical distancing, and this relates to having more than 1 bathroom. And there needs to be significant research into how to design apartment layouts to support physical distancing, because it's just not a consideration in current apartment design. So you can read more in our forthcoming paper in the special issue of IJAR. And I just wanted to end my presentation. My presentation has been about the future of housing, but it's also worth learning about the past and what we've previously considered healthy housing in Canada. So architects are thinking that the COVID-19 pandemic will surely change how we design cities and housing. And it's worth reflecting on the 1918 pandemic and the role that this had in shaping Canada's health and housing future. The so-called Spanish flu killed about 50,000 Canadians, almost the same as World War I. And the dense, crowded, unsanitary conditions were thought to be partly to blame. So Canada realized that we need to have a national response to the pandemic. And the Federal Department of Health was formed in 1919 to provide a coordinated Canadian federal response. the photography of these housing conditions by Toronto city photographer Arthur Goss, commissioned by Charles Hastings, the medical officer for health, help Canadians visualize and help politicize the role of healthy housing and public health. So it drove home a message that people's living conditions and basically that other people's housing can affect us. So we need to raise the minimum standards. And while the high-rise housing I've shown is nothing like the unsanitary conditions of these horizontal slums, I'm trying to argue that we could take this opportunity to think about a coordinated Canadian national response to housing standards and think, how can we take this opportunity to really improve quality of life in apartment housing, because we've built so much of it. Many of it is in need of renovation. And I think there are significant social and economic and political factors at play. So what can we do as a coordinated response to healthy housing and quality of life given this COVID-19 pandemic? Thank you.
Terri, thank you very much. So now we're going to open up our question and answer period. And I'm going to ask Nico in a second to ask the first question. We've got 2 questions already in the Q&A. So for everyone who joined us today, for our participants, if you've got other questions you'd like Terri to answer, if you put them in the question and answer, then Nico and I will try to make sure they all get answered. But Nico, you get to start. So over to you.
Sure, sounds good. Thank you so much, Terri, for the great presentation. To first start off with the Q&A, I'd like to ask, we know that COVID-19 has disproportionately impacted low-income and people of color communities in Toronto's inner suburbs. And given that context, what are some opportunities or lessons learned from your research to incorporate healthy and restorative design in new or old apartments that house low-income and people of color post-pandemic?
That's a great question. I think the renovation of existing apartment housing is a huge challenge. It's probably I think it's a really worthy challenge and investigation. In my opinion, what we should be focusing on is connecting the building science aspects to the social and experienced aspects. I think we need to go talk to people and do more field work, obviously not during COVID-19, but we need to find out how are people experiencing this housing and connect people's experience to standards. And really, we don't even know what we have, honestly, in terms of quality of life in these buildings.
Thank you, Terri. I don't know if you've ever met Jay Pitter, who's a Toronto urbanist, but Jay Pitter had a pilot project this summer where they were trying to do some work inside spaces to bring in more light and to change conditions. So we've got some interesting experimenting happening under Toronto leadership here right now.
Yeah.
Okay, let's go to the question from Catherine Jenkins. Catherine asks, wondering if you've looked at the impact of noise. My downtown Toronto apartment is surrounded by roadwork and apartment renovations. I'm finding it really challenging, especially as I'm at home all the time.
Yes, that we did find quite a few studies looking at the influence of outside noise, street noise, car noise, construction noise on quality of life in apartment housing, mostly to do with sleep. Mostly to do with sleep interruptions. It's definitely a significant concern. And as far as I'm aware, it's not something that we're considering in housing design at all. I don't think there's anything really, I think more or less people are considering noise within a building. But if we're going to promote passive strategies like opening your windows at night, which is definitely, designed to improve sleep, we need to be able to have a way of doing that without being constantly disrupted. So I think that's an area that needs urgent research.
Great, thank you. And we have a next question from Amanda Lang, and she asks, although it's early, how are you finding policymakers are responding to the idea of improving housing standards in Canada?
I think that it's early to say, like, as you said, I'm kind of wondering what will be the policy outcomes of COVID-19 or the relationship to healthy housing. Like, I'm wondering if, is it called universal income? I'm wondering if something like that might come out as a response to housing quality needs. Like, the affordability issue is so severe that people are having to accept housing quality that they're not happy with and that doesn't meet the minimum standards. So I'm wondering if there will be economic and social and political implications that go far beyond architecture. I feel like architects can only kind of do so much. We need new policies that help support people be able to afford higher quality of life in the city.
Okay, great. So next question from Lauren White. I'm wondering how we can incorporate these design elements without risking affordability.
Yeah, good question. Good question. So the question is, so do we focus on new housing, but actually the real problem and the real opportunity is in existing buildings. So how do we retrofit these buildings, which often need to be retrofitted anyway? If we're already doing it for energy performance, let's make it nice, right? So I think that we need to change the way, based on my experience in Denmark, there was a change in how 60s and 70s apartment housing was renovated based on quality of life, not just building science, energy savings. So I think we need to look carefully at how we're prioritizing energy retrofits of these buildings and really focus on quality of life at the same time.
Great, awesome, thank you. And we have a next question from Cameron McCoy, and he asks, can we design healthier spaces while also moving towards net zero emission buildings, which we know we need to do to achieve our climate goals?
Yeah, often we're setting up a kind of dynamic where it's us versus the environment, right? It's like can we have healthy buildings or can we have high performing buildings? And I think that we need to change that mindset to be more looking at the co-benefits. I wrote a paper in a special issue of a journal called Design for Health, Sustainable Approaches to Therapeutic Architecture. I wrote this paper called Super Architecture, looking at how health promoting architecture, often the same strategies used are environmental, like pro-environment behavior and environmental performance strategies. So passive strategies would be my answer. If we focus more on strategies that are low energy, take advantage as much as possible, even though that could create more variability and comfort conditions, I think that could be a direction to go in, but it's a huge challenge.
Great. Okay, next question comes from Theodora Popescu. They ask, I'm wondering if you've looked at how daylighting and lighting in housing can be improved during the winter months when our access to daylight is shortened so much. I'm sure as you're aware, there's a drastic decrease in lighting during the winter and it can affect one's mood and productivity. How could this be fixed or improved?
That is something that I'm currently looking at. There's a few ways. For one, I would say single aspect units, like where light is only coming in from one side. We need to really reduce those that we build. They're not providing quality of life. What if you have that north facing unit, right? And it's just got this one window and you've got the same lighting condition as your bedroom as you do in your living room. These are common. This is a common practice. So I think we need to have much more research and actual regulations, and we need to make some choices about how we want to light these buildings. Corner units are significantly better, but through units that have passive possibilities for light and air, where you have windows on both sides of the unit, that's my wish for how we would design housing in the future. It's hard to retrofit that, so we have to get it right the first time.
Great, thank you. And our last question for the Q&A comes from Anne, and they're wondering, who are these recommendations addressed to? Is this for governments to input as requirements into building codes, or is this for design firms to use as best practices for luxury units?
The design guidelines that we published in this paper are based on looking at a literature review of state-of-the-art of housing research and intersecting it with restorative environmental design. So our audience is primarily academic. However, the work from the Merb design guide that I showed in the second slide, that's received funding from BC Housing, which is a research organization that supported our research to create a design guide for designers and students and professionals and people that are looking to build this housing, because currently there are no design guidelines for daylighting strategies in apartment housing. There's very little standards, very little design guide sort of guidance for how to do this. So we did simulation-based research and then put the findings and the summary and tried to make it into a guideline in that document. So we're really trying to impact practice as well as academia.
Thank you, Terri. You know, I think one of the interesting things about this research is, in addition to those stakeholders, I could imagine tenants' rights organizations, including people like Acorn, taking up your research and using it to help push on policymakers and politicians to direct the resources we need to make better decisions. I mean, at the end of the day, that's one of the interesting things that we're trying to do with City Building Ryerson is this work is impactful in its own realm, but when we start to knit together planners and architects and public health officials, and people who are doing activism work, we start to see the power of research affecting change in community, which is at the heart of the series that we're convening. So thank you, Terri, and say to all of our people who came to join us today, we're very delighted that you were able to come. We hope that you'll come back for the next three sessions in our series. Next week on September 30th, we have Dr. Ann Harris, who's coming to speak about their new report on how cycling infrastructure can save lives. On October the 7th, we've got Dr. Linda Rothman, who's talking about public road safety as a public health issue. And then on October 22nd, we wrap up with Dr. Rakti Mitra, who's mapping children health activity during the COVID pandemic. So as you can see, there's an interesting intersection or thread running through, which is how can research actually make a difference on the ground in communities, both in Toronto, in the broader GTA, and across the country. So thank you to the 93 people who joined us today. That's terrific. We're very excited at City Building Ryerson to extend the reach of our work and to start to meet new colleagues. We hope that you found this interesting. We'll keep a list of the questions, and you have information on how to contact Terri to follow up on her important work too. Thank you, Nico, for being my co-host today. And thanks to the team at City Building Ryerson for making this webinar work today. Look on our website soon for a posting of all of this in case you'd like to watch it again or share it. Thank you, everyone. Have a great day. Bye.
Bye.